Y'all, thank you for coming. Restricting visitation to our state's nursing homes and assisted living facilities back in March was a heartbreaking necessity, but it was the most effective way to contain the spread of COVID-19 and to save the lives of our state's elderly and at-risk residents. As you know, we've had a lot of elderly people in our nursing homes pass away during the virus. As expected, the months of the separation and isolation have caused loneliness, depression, stress, anxiety among the residents. And I worry about them like you do every day. I worry about the physical and mental and emotional health as you do every day, and as their loved ones do every day. It's been frustrating for all of those who are worried about a parent, grandparent, or their loved one's well-being. I've spoken with them, perhaps you have too. I've read numerous letters, I've had phone calls, I've had face-to-face conversations, and I've heard the pain and frustration in their voices and in their words. We know that we have no policy or procedure that can eliminate all possibility of risk. We can't do it. But the time has come, based on what we've learned, what we've experienced, to reunite our family members, loved ones, and caregivers safely as best we can. You might recall that back in June, right after I'd asked the Department of Health and Environmental Control to develop visitation guidelines for the nursing homes and assisted living facilities, that we had to postpone releasing them due to the rising rate of infection and hospitalization. I've told you before, we had the executives and representatives of all the hospitals in the state, I believe, at one time in the conference room expressing their concerns about that rising rate and the possibility of a lack of hospital availability. So that's why we postponed that measure at that time. We are committed to protecting the physical, mental, and emotional health of our elderly and at-risk people and their loved ones. The guidelines that DHEC has developed will require a number of things, as they will explain to you. They will require the testing of every resident, the testing of every staff member, and there will be repeated tests there, and there will be testing for visitors. Strict rules and procedures must be followed if this is going to work. Facilities will be monitored by both DHEC and the Department of Aging's Ombudsman, who is here today. They have a program for monitoring compliance. Recently, the Department of Aging created a working task force. As visitation resumes, they will be monitoring this progress and the process under this process, and they will take public input and make additional suggestions to DHEC on needed policies or procedures. So this is another situation where we have everyone involved to see that we're doing the best we can and following the rules of safety. The last thing that any of us here or any of you want to see is for visitation in any nursing home or facility to be temporarily suspended because of an outbreak. But we can prevent that. We can do this. That's why it's important, vitally important, that family members and loved ones follow each and every one of these requirements. It'll be explained in a moment, before and during your visit. And again, there will be ample testing of the residents and the staff, and there are rules and procedures that if we follow them, we think we can accomplish this and then move to the next step. Director Marshall Taylor, DHEC.
Thank you, Governor. Good afternoon. We understand how difficult it has been during these past few months for friends and families to be distanced from their loved ones who reside in nursing homes and similar facilities but we believe the visitation restrictions put in place by the governor's executive order have helped to save lives and have helped to protect the health and well-being of the dedicated workers who care for these residents. We're happy to announce today that new guidelines are now in place that allow certain facilities to provide limited outdoor visitation between residents and their loved ones. There are two very important notes to make about these guidelines, which Dr. Duvey will discuss in more detail in a moment. First is that protecting the health and well-being of nursing home residents is the center of this plan. Second is that these guidelines do not mean that visitation is available for everyone at every facility. These guidelines provide carefully developed criteria that, if met, can allow a facility to implement socially distanced outdoor visits. DHEC's doctors and medical experts have worked closely to develop these guidelines, and we hope that they restore some peace and joy to the vulnerable residents of long-term care facilities and their family and friends, while also being protective from this deadly disease. I'll now turn it over to Dr. Duvey, our Public Health Director, for additional information.
Thank you, Director Taylor. Thank you, Governor. Good afternoon, and thank you all for being here as we share the DHEC guidelines for limited outdoor visitation at nursing homes and community residential care facilities, or commonly referred to as assisted living facilities. DHEC also recommends that these guidelines be used by those intermediate care facilities for individuals with intellectual disabilities. As I share some key points about these guidelines, I want to assure you that our first priority when developing these guidelines was to protect both the physical and mental health of our loved ones who call nursing homes and assisted living facilities their home. As we are all too aware, this virus has claimed them as among those at highest risk for developing life-threatening and life-ending complications. These limited outdoor visitation criteria and guidelines are based on the most recent CMS guidelines for reopening nursing homes, CDC guidance for COVID-19 in nursing homes, and DHEC's long-term care facility testing guidance, as well as visitation plans from other states. Before I begin to speak about the specifics of the plan, it's important for all of us to understand that each facility will need a reasonable amount of time in order to meet the criteria that we have outlined in these guidelines. This means that outdoor visitation will not happen immediately. In addition, it will be the responsibility of each facility to decide how it is best able to implement these guidelines and limited outdoor visitation while protecting the health of their residents and their staff and also the health of their visitors. Facilities may choose to implement more stringent visitation requirements than these required guidelines, but they are not permitted to be less stringent. Allowance for outdoor visitation will be based on certain criteria, and these include the disease transmission level within the facility, availability of appropriate amounts of personal protective equipment and staffing, and that testing is occurring at the facility in accordance with the federal CMS testing requirements. There are 3 triggers that could temporarily suspend visitation at a facility. 1, if one or more cases are identified in residents or staff members, visitation must be temporarily suspended until the federal CMS protocols for testing in response to disease at the facility are completed. This could take a few days or longer depending on whether we identify more cases in addition to the 1. 2, if 3 or more cases are identified in staff members or residents within a 14-day period, visitation must be temporarily suspended and testing must occur per federal CMS guidance. Visitation may resume 14 days after the identification of the last case. 3, for a nursing home, if testing is not occurring per federal CMS requirements, visitation must be temporarily suspended. For assisted living facilities, testing must be occurring per these same CMS protocols within 30 days from when these guidelines are issued, or visitation must be temporarily suspended. Currently, there are 90 nursing homes in the state that meet the criteria of not having cases among residents or staff within the previous 14 days. Additionally, there are 31 nursing homes that have only had one case in the last 14 days and would hopefully soon meet this criteria as well. In order to reduce the risk of virus being unknowingly introduced into nursing homes or assisted living facilities, the maximum length of time permitted for an outdoor visit will be based on the testing status of the visitor. A visitor may be allowed to visit for up to 1 hour if they present a medical record documenting either a negative result from a viral test performed within the previous 5 days, and this would be a test from a nasal or oral swab or a saliva test, or a positive result from an antibody test performed within the past 30 days. A visitor who hasn't been tested or doesn't present a medical record documenting a negative test for the PCR test or a positive test for the antibody test may be allowed to visit for a maximum of 15 minutes. All visitors, regardless of test results, must pass a COVID-19 screening prior to their visit and must adhere to the rules in place for the visit, such as social distancing, staying at least 6 feet away from their loved one, and wearing a mask properly at all times. Our DHEC staff remains committed to protecting the health and well-being of nursing home and assisted living facility residents, as well as those dedicated workers who care for them, and we will work with the facilities across the state to help them implement these limited outdoor visitation guidelines. Over the past several weeks, DHEC has performed in-person infection control surveys at all 194 licensed nursing homes in the state. In addition, DHEC staff have performed 102 infection control desk reviews of community residential care facilities, those assisted living facilities, and 95 infection control inspections of assisted living facilities in the state. During those inspections, we were able to assess that appropriate disease prevention protocols were in place at each facility, and we were able to perform follow-up surveys at facilities if we had any concerns. As these new guidelines are implemented, it's also important to remember that 129 South Carolina nursing homes have taken advantage of the CMS COVID-19 Communicative Technology Grant, and they have received funding to connect residents with their loved ones and family members using tablets, smartphones, and other devices. This grant support provided a way for nursing home residents to see, hear, and talk with their loved ones remotely, helping to maintain those connections with loved ones that are so critical to mental health and well-being, while also keeping our nursing home residents protected. With these new guidelines, the governor, the facilities that care for our loved ones, and DHEC are so happy to bring those critical connections from cyberspace to outdoor spaces. And we look forward to many socially distanced but happy reunions. You can find these guidelines for limited outdoor visitation in full on DHEC's website, on the Nursing Homes Resource webpage, which is accessible toward the bottom of the main COVID-19 landing page. Questions about a facility's current visitation status should always be directed to the facility itself, as they will have the most up-to-date information. Thank you very much. And now I would like to turn it over to Director Connie Munn.
Thank you. Good afternoon. Thank you, Governor, for having us here today. I'm here representing the task force. I'm Connie Munn, and I'm the director of the Department on Aging. We have some of the task force member here with us today. Dr. Trexler, with DHEC is here. I have Tim Womack, who is the South Carolina Association of Area Agency on Aging Director, and I have Dale Watson, who is our State Long-Term Care Ombudsman. We are here today to show our support to the Governor and to DHEC for these guidelines that have been released. As Governor McMaster mentioned, there are numerous, hundreds of phone calls that we all receive, and I'm sure the public as well has received the same phone calls from concerns. Our number one focus is to keep the residents safe in the nursing homes, and this task force has been instrumental in coming together to work to look at the guidelines DHEC is providing. Members who are not here today but also serve on the task force, we have AARP representation, we have the Alzheimer's Association, and the Nursing Home Association is represented as all. All are very active members of this committee, and again, our focus is to look at the DHEC guidelines that are published and to help have the message across the state that we're all in this together. We encourage family members to go to the website to review the guidelines. As you've heard mentioned here today, we don't want to go backwards. We want to continue the visitation, so please pay close attention to the guideline regulations that have been established. And our group that meets, we continue to meet on a weekly basis. They're very committed. As you can see, they're stakeholders across the state, and particularly with the Alzheimer's Association, they've been very helpful in providing guidance with loved ones suffering from dementia and how we might need to set up regulation and visitation. So I appreciate the opportunity to be here, and I appreciate the opportunity to lead the task force. Thank you, Governor.
Thank you. Thank you. Thank you. Well, as you can tell, there's a lot of thought and work went into making these plans, as they have in those we've had before. Both as the virus approached and as it arrived, we took a careful, methodical, determined, step-by-step approach, and we're doing that now to move out to where we'll fully get back to life as much as we can. We realize that this visitation, or the absence of it in the nursing homes and the other long-term care facilities, has been a tremendous burden on people. We're aware of that, just as we're aware that the schools not being open have been a burden on many parents, and as we're trying to open them back up as much as we can now, and that is still a burden on a lot of working people, and life is still disrupted, but we're getting back to our regular functions as quickly and as safely as we can. And I want to thank DHEC and Connie Munn, the Department on Aging, and all the associations, AARP and Alzheimer's and others, for the insight that has been made available to our team as we've developed these procedures. So with that, are there questions? Yes, sir.
This is a question for the director, if you could speak to this. Obviously, this community has been hit very hard when it comes to COVID-19 and deaths. Does DHEC have any expectation as to how the introduction of visitation could impact those numbers as we move forward?
Well, we've taken great strides in these guidelines to prevent the transmission. This is outdoor. It's socially distancing. It's wearing masks. It's only allowed at facilities that do not have cases in them, and so the risk of some type of explosion due to this activity is relatively low.
I have a question in terms of this making sure that these guidelines are being implemented. Will DHEC be making routine checkups at certain facilities to ensure that the nurses and the workers are following all these guidelines?
Dr. Duvey?
Thank you. Thank you. That's a great question. So DHEC is going to be requiring daily reporting from these facilities. We'll be requiring them to tell us how much PPE they have available, that reassure us, in fact document that their staff have been tested according to the protocols, that if they have a case that has been diagnosed in the facility, that is reported immediately, and they have begun the full-scale testing of every single resident and staff in that facility as a result of identifying that one case. So we feel that everybody wants this to happen, and we feel that people are, the nursing home administration and the staff are going to be very forward-facing with this information with us. In addition, we are required under CMS, they are required under CMS guidance to do this testing, and we are required under CMS guidance to respond if there are cases identified. So that will give us eyes on and boots on the ground if we identify 3 cases to work with the facilities. And I want to really emphasize that this is about supporting facilities and helping to protect residents. You know, I am really confident that that we'll be able to manage this with all the things that we have put in place.
Dr. Kirby, as a follow-up, if there's a positive test, can you explain in layman's terms what the CMS guidelines are for a facility to do? They have to test everyone?
Yes.
One positive test? Okay.
Yes, they have to test.
Every resident?
Yes.
And is this limited in the guidelines that says loved ones? Is this limited to immediate family members doing visits, or can it be uncles, aunts?
So there's no mention of who those visitors can be. There's an age restriction. I believe it's 14 and older. Is that right, Brandon? 12 and older. 12 and older, thank you. So 12 and older, and a number restriction, so no more than 2 visitors at a time.
And there can be exceptions to that 12 and older, depending on the circumstances.
Yes, oh yes, 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 yes.
Dr. David, did you say 31 homes have had no new cases within 14 days? Is that right?
Nope, I think it was 90?
90?
I'm going to tell you. Was it 91?
I think it's 91.
Yeah. Sorry, I'll find it for you.
That's okay. Is it fair to say that
90.
group? 90?
Yes, nursing
Fair
homes.
to say that group is the homes that could begin visits the soonest?
Yes, I believe that is sort of how we're thinking about this, but of course there are other things they need to be doing. They'll need to have a plan prepared, a visitation plan. They'll need to submit that to us. They'll need to be reporting to us all those things I mentioned previously. And staff will continue to be tested on a schedule that is directed by the CMS guidance. So if a staff is identified between now and when all those other things happen, then that will result in testing of all the residents at the facility. But that is what we hope to happen.
Do we have any rough idea for those 90, how quickly the doors could actually be reopened at these places?
The minute I provide you a date, something will come up and they won't be able to reopen. We'll identify a case or something like that. Let's just suffice it to say that we will work with them to open to visitation as quickly as possible. And please keep in mind that the facilities themselves have the ultimate control over when this happens.
Yeah, question for the director. In the guidelines, it talks about giving special consideration to patients who perhaps are emotionally more at risk or potentially have suffered the most. I guess a lot of family members would probably argue that their family member has significantly suffered emotionally. What guidance are you giving the nursing homes as to maybe how to handle that issue?
Well, I think the nursing homes know their patients best and know their situations the best, and so we would defer to the nursing homes to determine what line of priority. We just want it, this, like we said before, this is just guidance, so this is something for them to consider when they're making appointments for visitation.
More questions? Yes, ma'am.
This is not necessarily related to the nursing homes, but more about testing in general. We've seen some reports that some labs have not been bringing in their negative test results. What kind of impact does that have on our overall positive case rate here in the state, and what impact would that have if we see it's higher than we think on the nursing homes now?
Well, that's been a question in every state since the very beginning, to be sure that the accurate numbers are being turned in and reflected. But DHEC is looking into that. They've been looking into it to be sure that they are presenting the accurate information. Any more questions? Yes, sir.
$525 million is coming into the state's general fund after the lawyers who are paid from the plutonium lawsuit. What do you think that money should be spent on?
We have plenty of needs, but that'll be for the General Assembly. As you know, the Senate is coming back Tuesday and tomorrow, and the House will be back on the 15th. Those will be questions that they'll. But my view is we don't know what's going to happen in the future. The forecasts have been changing as we've gone forward, and we do not expect to have nearly as much as we had early expected to have. So I'm hoping that we will not create a new budget and spend extra money, but that we will hold the line with the continuing resolution and wait till we get to January when things are a little more stable and we can see a little better how much is coming in and what our needs are. Mr. McKinney.
Governor, on that same line, Senator Rutherford this morning said he thought the remaining $600 million in the CARES Act should all possibly go to the unemployment insurance fund.
Well, I certainly think that I agree with the senator. We've been, and a number of us have been expressing that view. I don't think there are many that disagree with that. We need to get that unemployment insurance fund back up because, as you know, that's where the businesses pay the money in for unemployment. We've taken, I guess, out of South Carolina funds in unemployment insurance fund about $900 million or maybe more, and we only started with about 1.1. So we need to fill that back up as far as we can before we start putting money on other things, because it was not the business's fault that this virus came along and that they had to close down and restrict themselves.
Do you support all of the remaining $600 million going to that fund?
I want to fill the fund back up the way it was when the virus hit us.
Governor McMaster, several organizations, including the NAACP, sent you a letter last week asking that you put a pause on evictions. Is that something that you think you'll consider?
That'll be a question for the legislature. As you know, the Chief Justice has had a pause as well, but that'll be a question for the General Assembly.
Governor?
Yes, ma'am.
So we've seen reports, of course, of some fraternity or sorority houses at USC being infected with the coronavirus or quarantine. What we're doing for the nursing homes is great, like you said, about the emotional well-being of the elderly, but there's this disparity, right? We have the nursing homes reopening, but younger people are going out contracting the virus, not following those guidelines. What would you have to say to those younger people, those students, as they're going back to school?
Well, the same thing we've been saying, and that is everybody knows what to do. We're not back at March. We know how it's spread, we know how fickle it is, and we know how easy it's spread, and we know how the results, particularly in the older and those with underlying conditions, how dangerous it can be. We know what to do. Now all we have to do is do it. And I would say to everybody, don't wait for somebody to tell you what to do. You know what to do. Go ahead and do it. And if we all stick together and do the right thing, we can get out of this. If we are careless or reckless, then there'll be consequences. Yes, ma'am. Over here.
You mentioned testing visitors for the nursing homes. How exactly is that going to work? Is there going to be instant rapid testing for the visitors? Is it going to be get tested and they'll approve you to come back?
Hold just 1 second.
Thank you. Great question. So DHEC is committed to establishing testing sites weekly in every county. Visitors who would like to go do an outdoor visitation with the nursing home can go to one of those sites and get tested at no cost to them. In addition, there are testing sites that are regular pop-up sites, et cetera, that commonly occur around the state. So that's another opportunity for testing at no cost. They could go to a healthcare provider. In addition, there's the antibody test that they could do if you donate, if you know that you've had COVID-19, you have a positive test. You can go and donate serum, actually, and we call that convalescent serum, and that contains antibodies. They will do the antibody test for you at no cost. You get the test result, and a patient somewhere, hopefully in the state of South Carolina, will derive benefit from the plasma that you have donated. So
So they would have to show their results
Yes.
within minutes?
Yes.
Is there a time frame? Is it, results within 72 hours, or
Yes.
someone takes a test the week before, is it still valid?
Yes. So the nasal swab, oral swab test, or the saliva test, 5 days. In the antibody test, a positive antibody test dated within the past month.
Yes, sir.
Are all facilities equipped for outdoor visiting? And if they're not, how will you move forward with those visitations?
So that is up to the individual facility, and they will include that in their plans. There may be some facilities for which that's easier than for other facilities, but we know that these facilities will be creative and will hopefully find a way to provide space for this to happen.
Was there any serious consideration of allowing some special indoor visitation, and are there any special exceptions that you might make?
Yeah, the compassionate care visits, I'm glad you asked that. So this has been occurring even throughout the pandemic. A resident at the end of life is entitled to compassionate care visit from family members.
But not for other patients? No indoor visits?
That's right, yes.
Governor, state leadership has obviously made a decision that it's time to move forward with this initiative. Is there a threshold where if the situation worsens that we might have to roll this back?
I'm sorry. You said governor, so I missed the first part of the question.
So state leadership has obviously decided to move forward with this initiative. Is there a threshold if the situation gets worse with COVID-19 that we might have to roll this back?
So the threshold would be determined by the number of cases in the facility. If we can ever get to a point where we've had no new cases for 14 days, then we cannot reopen visitation, and hopefully that won't occur because of the CMS guidelines that assist with testing.
So a statewide situation may not directly impact a nursing home in particular.
Right. We wrote these guidelines to make sure that we were protecting the families, the residents, and the staff. So with the testing, we can have we can feel comfortable knowing that we have layered those protections, masking, social distancing, testing, and then symptom screening and temperature checks as those visitors arrive. And so if we know there are no cases in the facility, we know there are no cases in the staff, and we've done all this layered protection, then we feel confident that we are not increasing risk at that facility.
Sorry.
Let's go to Joe.
Governor, do you still believe it's a good idea for students to return to classes, especially we're seeing in other states where there have been outbreaks in certain schools, and what's your plan if schools start to have lots of cases within their buildings?
Well, each school district has their contingency plans for that, but we know that the best place for children, parents, and teachers is in the classroom face-to-face, and we are encouraging the schools to think and be innovative in the districts and to get those children back in there. We want the parents who want their children in the school to have those children in those schools. That's the best place for them. We know that. As the children are older, as they become young adults, distance learning, of course, is a lot easier. But at those tender ages, they need to be in those classrooms. Yes, sir.
Governor, separate from hospice patients, there may be some nursing home patients for which outdoor visits just isn't realistic, considering the health conditions. What would you say to those families? And is the state prepared to offer any other alternatives to those families? Well,
I'll say the state is prepared to do all we can to see that these visitations take place. There's plenty of personal protective equipment available now, unlike at the beginning of this, from sources all over the place. And the combinations, the Nursing Home Association and others are grouping together to be sure that if they just need a small supply, that they can group up with others to have a larger supply to get it all in very quickly. The Emergency Management Division has a stockpile of equipment if necessary, but we are monitoring this to be sure that there's plenty of protective equipment for these nursing homes. Do you want to address the rest of that?
In addition to that, we know that there are opportunities to transport patients who are not mobile, right? Wheelchairs, reclining chairs for those patients who may be bedridden, and even mobile cots that can be pushed and rolled outside. So it is our strong preference that these visits occur outdoors so that we don't increase the risk for all residents in the facility by allowing indoor visitation at this point. We will by the 1st of October. That's our target for having developed indoor visitation guidelines. So we will be working on that. And hopefully at some point before the weather turns cold, we will have, figured out how to do this safely indoors as well.
Last question, if there is one. Hearing none, we thank you very much. And I want to thank Holly Mae and Michael Chappelle again. Thank you very much.